Hello, my dear nursing aspirants and my dear students. Welcome you all to your channel Nursing Concepts by Raghav. So today I'm gonna deal a very important concept. So that is actually one of our subscriber commented, "Sir, please take this concept in your next video." So based on the request that I got from, so that shows that motivates me. Your comments motivates me to do the classes on your request or on the concept that you have more interested. And basically, what the concept I am taking today is one of the important topic or the concept for NORCET and other competitive exams as well. So let's start with the today's concept. This is the today's concept is the Glasgow Coma scale. So this is one of the very essential scale or the routinely done an assessment scale for the patients who comes with an history of and trauma or met with an accident, or any patient with a decreased responsiveness or decreased level of consciousness. So this for these patients we commonly do this assessment scale to know their level of consciousness. तो चलिए देखते हैं इसका डिटेल में समझते हैं एक ग्लास्को कोमा स्केल क्या होता है. सो व्हाट एक्चुअली इट इज़ एंड हाउ इट इज़ टू बी असेस्ड, व्हाट आर द स्कोरिंग given based on the assessment, and how we will interpret this scale based on the assessment score given to the patients. So then without wasting time, let's get into the topic. So I request, if somebody is watching for the first time, then please do subscribe and watch it till the end of the video, so that you will understand the whole concept of what I'm discussing today. So come, let's start with the today's concept, that is Glasgow Coma scale. So first we'll understand what actually the Glasgow Coma scale is. See, as I told, the scale means you remember the scale means here we give some numbering to some criteria. So we have some parameters. So for those parameters, we will be assessing those parameters. So based on the responses given by the patients, or based on the observation done by the healthcare worker or the doctor or the physician, so he will give some numerical values. So that is what we call it as a scaling. So here the Glasgow Coma scale. So the name itself indicates. So Glasgow is a coma. Coma means it is related to the level of consciousness. So means where the patient, coma stands for the where the patient is not aware of himself and the surrounding environment for the longer period. Then we usually consider it as a coma or comatose state. Scale, as I told, so it is given some numerical value for the parameters that we assess. See, if you look at the definition or the meaning of Glasgow Coma scale, it is an standardized neurological assessment tool used by the healthcare worker providers to objectively measures and communicate the patient's level of consciousness. Remember, the Glasgow Coma scale is majorly done to assess the level of consciousness. LOC we call level of consciousness. Then what actually means by this level of consciousness? Level of consciousness is nothing but it's a degree of awareness and the wakefulness, whether the means how much the patient is awake, and how much he is aware of himself and the surrounding environment. Okay, so that is all we call it as a level of consciousness. To understand only this, how much is awake and how much is aware of his self and the surrounding. So to understand this level of consciousness, we usually use the scale, that is Glasgow Coma scale. So you may get a question in the that is exams, like what is the major objective of the Glasgow Coma scale? See, here it is not being done for the neurological examination. Okay, so remember, this is not an tool for the neurological examination. It's not being used for neurological as a tool of neurological examination. Means we are not going to assess any kind of nerve functions or the brain functions here. So we just usually assess the patient's level of consciousness. So it is not a tool for neurological examination. Remember this. Okay, so then what we are going to assess in this GCS? So here there are three major areas or the parameters that we assess in the GCS, that is eye opening. The first one is the eye opening, second is a verbal response, then motor response. So in short, we can say eye opening, we usually call it as E, V and M. Okay, so these three parameters we usually score them in an EVM format. So that indicates the Glasgow Coma scale. So चलिए देखते हैं ये आई ओपनिंग, वर्बल रेस्पॉन्स और मोटर रेस्पॉन्स को कैसे असेस करते हैं and how we give the scoring for these each parameters. So first we'll see the eye opening. The eye opening, here we give the a minimum score of 1, so the maximum score will be a 4. The minimum score is 1 and max score is a 4. Okay, so a max score 4 means the patient condition is bad or there is no eye opening. See, what are the scores of indicates? Sorry, 1 means bad condition, 4 means is completely healthy or completely well. See here the 4 stands for where the patient opens his eyes spontaneously, means without any stimulation the patient is very wake up and is looking here and there, okay, in his surroundings. He is completely aware that and is looking, okay. So spontaneous eyes are opened or his patient is opening his eyes spontaneously without any stimuli, then we give a score of a 4. Okay, then a 3 score will be given if patient responds or opens his eye to an verbal command. Okay, that means on examination the patient's eyes were closed and you give an verbal command. Okay, you will call by his name or you will shout. Okay, so to your voice, if the patient open his eyes, then the score will be a 3. Then a score of 2 will be given for the eye opening to the pain. Eye opening to the pain means we will make some or we will give some painful stimulus to the patient. Okay, painful stimulus usually we give by pinching. Okay, pinching the nail bed, so we call it as a nail bed pain stimulus. Or sometimes we do the central pain stimulus, that is we can what we can do is we can squeeze the trapezius muscle. Okay, this trapezius muscle can be squeezed, or sometimes we do the supraorbital ridge pressure can be given. If the patient opens his eyes when you do the painful stimulus, then the score will be given a 2. Okay, so for the spontaneous 4, to the verbal command 3, and to the pain then it is 2. If no any response or if there is no any eye opening even to the painful stimulus, the patient doesn't opens his eyes even for the verbal, even for the pain. Okay, so eyes were completely closed, then the score will be given a 1. So the minimum score is 1 and the max score is a 4. So these parameters you must remember: spontaneous 4, verbal 3, to the pain 2, and no response is 1. So now let's see how the verbal response is recorded. Verbal response. So how do you check this or how do you assess this verbal response? Here what we do, the examiner or the healthcare provider or healthcare worker, he will go and talk to the patients. Verbal means, so that is how the patient speaks or how the patient uh, talks. Based on his response we give them a score. So the first so here the minimum score is, minimum is 1 and max score is 5. Okay, V5 maximum. So what is the score? So the first, a score of 5 will be given for a patient who is completely oriented. So when you go and ask the patient what is your name, where are you from, where you are, what day today, okay, what is the day today. Okay, so if the patient is completely aware and is if he tells, okay, is correctly his name, whatever you ask the question to the patient, he is completely oriented to the time, place and the person, then we consider it as completely oriented, then as give a score of 5. and we will give a score of 4 if the patient is giving an confused answers. See what is mean by confused? So means you will ask the question, patient is answering, okay, but in an confused status, or you may tell like disoriented, or we can say the meaningless, or answers may be the wrong. Okay, if you ask like what is your name, he may tell the other name. Okay, that is not what actually is a name. So that is what we call it as a confused state, or answering in a wrong way, or in an confused status or disoriented status. So but the patient is answering to your questions, so that is what we consider it as a 4, that is confused answers or the wrong answers, or indicates the disorientation. Then if the response indicates the inappropriate word, inappropriate means they are not related to the uh, context what you are speaking. Okay, suppose if you are asking who are you, or what is your name, he may tell something, or he starts shouting on you. Okay, so he may tell anything which is not related to your question, or what not related to the context what you asked. So that is exactly inappropriate, or they are not appropriate for the situation or the question that you are being, that you asked to the patient. So the patient may shouts, okay, or the patients may speaks irrelevantly. So that is what we call it as a inappropriate words. Then the a score of 2 will be given for the incomprehensible sound. See here, the patient is making sound, but that are not having, doesn't have any meaning. Like if you ask something, patient says okay, morning sound. Okay, you can say incomprehensible words, sounds like uh, morning, incomprehensible like morning, or grumbling, hmm, hmm. So like this sound he will make. So this is called as an incompressible sound. We see here, we are not use the words, it is a sound. Okay, the patient makes some sounds which are meaningless, or doesn't have any meaning. So they are called as a incompressible sound. If patient makes incompressible sound, then that's the score of 2 will be given. And patient if doesn't give any response, there is no any response, or doesn't make any sound, then we give a score of 1. So the minimum score is 1, max is 5. Max 5 means it's completely oriented. 5 for oriented, 4 for disorient or confused, 3 for inappropriate, and 2 for incomprehensible, then 1 for no response. So this is assessment of verbal response. And the M, last one, is a motor response. The motor response, in this the what we do is we will assess the patient's motility, or the activity levels. Okay, so here the minimum score will be given 1, minimum score of 1, and the max score will be 6. So means here 6 components we do assess. So 6, a score of 6 will be given if the patient obeys your commands. So that means you will ask the patient to like hold my finger, or lift your right hand, lift your left hand. Okay, so then if he obeys your commands, if he capable of doing so, then we give a score of a 6. Then a score of 5 will be given who localizes the pain. So if patient is not obeying command, then the next comes is you will make some painful stimuli. So that is painful stimuli. As I told, the painful stimuli can be done by your nail bed pressure, or else squeezing your trapezius muscle. So if when you do the painful stimuli, say for an example you are doing it here, okay, you are squeezing the trapezius muscle, and patient localizes, he will try to take your hand away, means that means he is localizing the pain where you are making the stimulus. So then it is called as a localizing the pain, means the patient is able to identify where the pain is been stimulus is being given. So this is localizing the pain. Then the a score of 4 will be given for flexion or withdrawal. See here, the patient does not make no, does not localize the pain. Instead, when you make the painful stimuli, he will either withdraw, okay, or he will make the flexion of the hands or the extremities. So then it is called as a score of a 4. Flexion, either he will make the flexion or withdrawal. He will withdraw his hand and make some flexions, or he may make some withdrawal. He will take away the hand. So that is what the 4. But he will not localize just where you make exactly the painful stimulus. Then a score of 3 will be given for the abnormal flexion. See these 2, 3 and 1. See here, these all three were having the abnormal uh, abnormal flexion or the extension or any atonic reactions, means these are all abnormal. The 3 will be given for the abnormal flexion, or it is also called as a decorticate position. The decorticate position, where the patient, when you make a pain response, say for an example, if you make a here pain response, or if you squeeze the trapezius muscle, the patient makes an abnormal flexion, okay, of the extremities. Decorticate. Corticate means the core of the body. Core means the center of the body. So he will brings all the hands, both the hands, and there is an flexion like this, okay. So he brings both the hands on his chest and makes a extreme extension, sorry, the flexion at the towards the center of the body, that is core of the body, that is decorticate, okay. So this is called as a abnormal flexor position. So this is decorticate position. The decorticate position, if the patient makes a decorticate position on painful stimulus, then it indicates, or this position is indicates the damage to the cerebral cortex. So this indicates the damage to the cerebral cortex. So this decorticate indicates the cerebral cortex damage. Okay. So the next is a score of 2 will be given, where the patient makes a straightening of the arms, that is extensor position, and where the arms are been outwards, okay, they are extremely extended. So that is called as a decerbate position. So if the patient makes this position, then it indicates some damage or injury to the brain stem, indicates the injury to the brain stem. So then if doesn't make any response even after the painful stimuli, if there is no any motor movements or the motor activities are found, then it will be recorded as no response and a score will be given 1. So this is how do we assess the motor responses. So you can see the picture here, decorticate position and the decerbate position. In the decorticate, see here the hands, so they are being brought on the chest and they are being extremely flexed, okay. It is called as a flexor position. It is called as flexor position. So there it indicates the damage to the cerebral hemispheres or the cortex. Then that is the upper part of the brain stem. Then you look at this in the decebrate position, the hands are being extended by the side, okay. The foots are being pointed. Here also in the foots are being pointed, toes are being pointed. So this is the differences between, you should make out decorticate and the decerbate position. So decorticate position, as I told, it indicates the brainstem damage. So if the patient is with the decorticate position, the prognosis is very poor. So with this condition, the prognosis is poor, okay. So as compared to the decorticate position. So this is a you may get an image based question on this position, identify the position of position in the image, or you may get a question if the patient has a decorticate position, what is its interpretation, or what part of the brain is being having the injury. So that is you can identify it with the postures. So the next is how do you interpret the score. So as I told, so E's maximum score is 4, V's maximum score is 5, and M maximum score is 6. And the minimum score, this is a maximum score. So max, if you add all these things, 4 plus 5 plus 4 plus 6 plus 4 is 10 plus 5 is 15. So the maximum score will be 15, and minimum score, minimum as I told, every component has 1. So minimum score is 3. Okay, so minimum the patient can have a score of 3 or max of 15. So if based on the patient's response that we record on assessment, so if the patient gets a score in between 13 to 15, then it indicates a very mild brain injury like concussion. Okay, then if the patient's score is between the 12 to 9 to 12, that indicates the moderate brain injury. And if it is a severe, that is less than between the 3 to 8, so where the patient is usually in the coma. Okay, it indicates a very severe brain injury. Sometimes the question may arise like whether we can use this GCS score for considering a patient for intubation. So the question may arises like this. Okay, so can we use this score for considering a patient for intubation? So if the, see here the question having both the things, one is yes and another thing is no. Both answers are there, but when it is yes, so yes, it is only when there is a patient with the traumatic brain injury. Traumatic brain injury. So definitely if the GCS is less than 8, GCS is less than 8, it is definitely an indication for the intubation in a patient with a traumatic brain injury or any trauma cases where the GCS comes less than 8, there we can consider the patient for intubation. Okay, so in order to prevent the aspiration or to provide an adequate oxygenation to the patient, so as the brainstem can get injured, so the respirator status may be altered. So we can go for the intubation procedure in the case of a traumatic brain injury with the GCS scale of less than 8. It is no for other cases except the brain traumatic brain injuries. So other cases like the medical cases where the patient is having decreased response or the decreased level of conscious due to another medical conditions like hypoxemia, maybe hypoxemia, or maybe ketoacidosis, or maybe hypoglycemia. Okay, so many conditions are there where we can see the decreased or altered level of consciousness can be seen. So there also you can get a score of less than 8 as well. So as I told, less than 8 is considered for the intubation, but not for the other medical cases other than the traumatic brain injuries. See here, it is solely depends on the clinician or the doctor who decides whether the patient can be considered for the intubation or not. So the it may depends on the patient diagnosis, or it may depends on the hypoxic condition of the patient, or it may depends on the patient's swallowing ability or the airway management. So all these factors are being considered when we uh, consider for intubation when the GCS is less than 8. But for a patient with the traumatic brain injury or with the trauma, then definitely GCS 8 is less than 8 is an indication for the intubation. So these points you should keep it in mind when it comes to the GCS and the intubation. Okay, so this is all how we interpret the GCS score. So along with this GCS, so nowadays there is an additional component has been added to the assessment of a Glasgow Coma scale. So that is we call it as a pupillary reactions. So along with the assessment of eye opening, verbal response, and the motor response, we also assess the pupillary response. So that score we call it as a GCSP score. This is very important nowadays. The Even the NORCET is much interested in asking question on this GCS P score, or it is called as Glasgow Coma scale pupils, or Glasgow Coma pupil scale, the GCS P score. So the P indicates the, that is pupillary reactivity. So this pupillary reactivity along with GCS, that is EVM, we also record a response or the a pupil reaction to the light. So that is called as a pupillary reactivity score or pupil reaction to the light. So we will use the torch and we will observe the pupil reaction to the light. So if based on that we give the score, if both the pupils are reactive to the light normally, then a score of 0 will be given, and a score of 1 will be 1 point will be given if only one eye or one pupil is reactive and another eye is unreactive. So then it is given a score of 1. 2 point will be given where the both the pupils are unreactive or non-reactive. अगर दोनों आंखें या दोनों पीपल रिएक्टिव है तो 0 है, अगर एक आंखें रिएक्टिव है और एक आंखें नहीं है तो 1 पॉइंट है, अगर दोनों आंखें रिएक्टिव नहीं है, okay, then a point of 2 will be given. So based on this score, so here the maximum score is 2, minimum score is 0, and the max score is 1. So we do assess the score to calculate the GCSP, that is Glasgow Coma scale, that is P scale, that is pupillary reaction scale, or the pupillary score will be calculated by minusing the pupillary reaction score with the GCS. Okay, this is an equation, you should remember this. GCSP is equal to GCS minus PRS. PRS means that is pupillary reaction score, that is 0 to 2. Sorry, here I have made some mistake. The maximum score of 2. Say for an example, a patient a GCS score is like E is 4, V is 4, then M is 5. Okay, and his PRS, that is pupillary reaction score is, or pupillary reactive score is, consider 1. Then identify the GCSP. See here GCSP is equal to GCS. GCS how much it is? E4, V4, M5. 4 plus 4 is 8 plus 5 is 13. So his score is 13 and minus PRS, that is 1. So the score is 12. So what this score indicates, what this GCSP score indicates. So what is the interpretation? Why do we need to assess the GCS P score? See, this score indicates the, or it will help you to predict the patient's outcome. So if it is like more than like a 12 or 13 or up to 15, so then we can consider the patient's outcome or the prognosis is better. Okay, better, and the score of less we consider it as the outcome is very poor or the prognosis is poor. So that means the GCS score usually, or it will indicates the accurate prediction of the patient's outcome, especially in the traumatic brain injuries. So this is all about the GCSP score. So nowadays the questions are being asked on this concept, that is GCSP score. GCS is as usual, it's a regular clinical assessment. So it is an update. Okay, so we have to be updated with the what are the things gets updated to an concept or any topic. So we also have to update ourselves according to the recent updates. So remember GCSP score also one of the important topic. So you may get a question on this: how do you calculate the GCSP, or what are the points given on the based on the assessment of pupillary reactivity to the light. So that's all for the today's session. Hope you all understood the today's topic, that is a Glasgow Coma scale and the Glasgow Coma scale P score, pupil score. So hope the today's class was very clear and very informative, and please do watch my channel and subscribe and share it to the your friends or to your students, so that they can also get updated with the GCS and starts using this assessment in their routine practice. Okay, so till then, take care and keep working, keep studying, keep working hard. Okay, so let's work together. We'll find a way to the success. So thank you.